Question 1. The nurse is providing instructions to a pregnant client with human immunodeficiency virus, HIV, infection regarding care of the newborn after delivery. The client asks the nurse about the feeding options that are available. Which response would the nurse make to the client? 1. You will need to bottle feed your newborn. 2. You will need to feed your newborn by nasogastric tube feeding. 3. You will be able to breast/chest feed for 6 months and then will need to switch to bottle feeding. 4. You will be able to breast/chest feed for 9 months and then will need to switch to bottle feeding. Explanation. Question 1. Rationale. Perinatal transmission of HIV can occur during the antepartum period, during labor and birth, or in the postpartum period if the birthing parent is breast/chest feeding. Clients who have HIV will most likely be advised not to breast/chest feed. However, the PHCP's recommendations regarding breast/chest feeding are always followed. There is no physiological reason why the newborn needs to be fed by nasogastric tube. Test-taking strategy. Use knowledge regarding the transmission of HIV. Eliminate options 3 and 4 first because these options are comparable or alike in that they both address breast/chest feeding. From the remaining options, select the correct option, knowing that it is unnecessary to feed the newborn by nasogastric tube. Question 2. The home care nurse visits a pregnant client who has a diagnosis of preeclampsia. Which assessment finding indicates a worsening of the preeclampsia and the need to notify the primary healthcare provider, PHCP? 1. Urinary output has increased. 2. Dependent edema has resolved. 3. Blood pressure reading is at the prenatal baseline. 4. The client complains of a headache and blurred vision. Explanation. Question 2. Rationale. If the client complains of a headache and blurred vision, the PHCP needs to be notified because these are signs of worsening preeclampsia. Options 1, 2, and 3 are normal findings. Test-taking strategy. Note the word worsening in the question. Eliminate options 1, 2, and 3 because these options are comparable or alike and indicate normal findings. Question 3. The nurse implements a teaching plan for a pregnant client who is newly diagnosed with gestational diabetes mellitus. Which statement made by the client indicates a need for further teaching? 1. I need to stay on the diabetic diet. 2. I need to perform glucose monitoring at home. 3. I need to avoid exercise because of the negative effects on insulin production. 4. I need to be aware of any infections and report signs of infection immediately to my obstetrician. Explanation. Question 3. Rationale. Exercise is safe for a client with gestational diabetes mellitus and is helpful in lowering the blood glucose level. Dietary modifications are the mainstay of treatment, and the client is placed on a standard diabetic diet. Many clients are taught to perform blood glucose monitoring. If the client is not performing the blood glucose monitoring at home, it is performed at the clinic or obstetrician's office. Signs of infection need to be reported to the obstetrician. Test-taking strategy. Note the strategic words, need for further teaching. These words indicate a negative event query and the need to select an incorrect client statement. Also, Noting the closed-ended word avoid in the correct option will assist in answering the question. Question 4. The nurse is performing an assessment on a pregnant client in the last trimester with a diagnosis of preeclampsia. The nurse reviews the assessment findings and determines that which finding is most closely associated with a complication of this diagnosis. 1. Enlargement of the breasts. 2. Complaints of feeling hot when the room is cool. 3. Periods of fetal movement followed by quiet periods. 4. Evidence of bleeding, such as in the gums, petechiae, and purpura. Explanation. Question 4. Rationale. Severe preeclampsia can trigger disseminated intravascular coagulation, DIC, because of the widespread damage to vascular integrity. Bleeding is an early sign of DIC and needs to be reported to the primary healthcare provider if noted on assessment. Options 1, 2, and 3 are normal occurrences in the last trimester of pregnancy. Test-taking strategy. Note the strategic word, most. Focus on the subject, a complication of preeclampsia. Eliminate options 1, 2, and 3 because they are comparable or alike and are normal occurrences in the last trimester of pregnancy. Question 5. The nurse in a maternity unit is reviewing the client's records. Which clients would the nurse identify as being at the most risk for developing disseminated intravascular coagulation, DIC? Select all that apply. 1. A prima gravida with Abruptio placentae. 2. A prima gravida who delivered a 10 pounds infant 3 hours ago. 3. A gravida 2 who has just been diagnosed with dead fetus syndrome. 4. A gravida 4 who delivered 8 hours ago and has lost 500 milliliters of blood. 5. A prima gravida at 29 weeks of gestation who was recently diagnosed with gestational hypertension. Explanation. Question 5. Rationale. In a pregnant client, DIC is a condition in which the clotting cascade is activated, resulting in the formation of clots in the microcirculation. Predisposing conditions include Abruptio placentae, amniotic fluid embolism, gestational hypertension, HELLP syndrome, intrauterine fetal death, liver disease, sepsis, severe postpartum hemorrhage, and blood loss. Delivering a large newborn is not considered a risk factor for DIC. Hemorrhage is a risk factor for DIC. However, a loss of 500 milliliters is not considered hemorrhage. Test-taking strategy. Note the strategic word, most. Focus on the subject, the client at most risk for DIC. Think about the pathophysiology associated with DIC, and select the options that identify abnormal conditions. This will direct you to the correct options. Question 6. The home care nurse is monitoring a pregnant client who is at risk for preeclampsia. At each home care visit, the nurse assesses the client for which sign of preeclampsia? 1. Hypertension. 2. Low-grade fever. 3. Generalized edema. 4. Increased pulse rate. Explanation. Question 6. Rationale. A sign of preeclampsia is persistent hypertension. A low-grade fever or increased pulse rate is not associated with preeclampsia. Generalized edema may occur but is not a specific sign of preeclampsia because it can occur in many conditions. Test-taking strategy. focus on the subject, a sign of preeclampsia. Thinking about the pathophysiology associated with preeclampsia will direct you to the correct option. Remember that hypertension is associated with preeclampsia. Question 7. The nurse is assessing a pregnant client with type 1 diabetes mellitus about an understanding regarding changing insulin needs during pregnancy. The nurse determines that further teaching is needed if the client makes which statement? 1. I will need to increase my insulin dosage during the first 3 months of pregnancy. 2. My insulin dose will probably need to be increased during the second and third trimesters. 3. Episodes of hypoglycemia are more likely to occur during the first 3 months of pregnancy. 4. My insulin needs will return to pre-pregnant levels within 7 to 10 days after birth if I am bottle feeding. Explanation. Question 7. Rationale. Insulin needs decrease in the first trimester of pregnancy because of increased insulin production by the pancreas and increased peripheral sensitivity to insulin. The statements in options 2, 3, and 4 are accurate and signify that the client understands control of the diabetes during pregnancy. Test-taking strategy. Note the strategic words, further teaching is needed. These words indicate a negative event query and the need to select an incorrect client statement. Eliminate options 2, 3, and 4 because they are comparable or alike and are accurate statements. Remember that insulin needs decrease in the first trimester of pregnancy. Question 8. A pregnant client reports to a healthcare clinic, complaining of loss of appetite, cough, weight loss, and fatigue. After assessment of the client, tuberculosis is suspected. A sputum culture is obtained and identifies Mycobacterium tuberculosis. Which instruction would the nurse include in the client's teaching plan? 1. Therapeutic abortion is required. 2. Isoniazid plus rifampin will be required for 9 months. 3. The client will have to stay at home until treatment is completed. 4. Medication will not be started until after delivery of the fetus. Explanation. Question 8. Rationale. More than one medication may be used to prevent the growth of resistant organisms in a pregnant client with tuberculosis. Treatment must continue for a prolonged period. The preferred treatment for the pregnant client is isoniazid plus rifampin daily for 9 months. Ethambutol is added initially if medication resistance is suspected. Pyridoxine, vitamin B6, often is administered with isoniazid to prevent fetal neurotoxicity. The client does not need to stay at home during treatment, and therapeutic abortion is not required. Test-taking strategy. Focus on the subject, therapeutic management for a client with tuberculosis. Recalling the pathophysiology associated with tuberculosis and its treatment will assist in eliminating options 1, 3, and 4. Question 9. The nurse is providing instructions to a pregnant client with a history of cardiac disease regarding appropriate dietary measures. Which statement, if made by the client, indicates an understanding of the information provided by the nurse? 1. I need to increase my sodium intake during pregnancy. 2. I need to lower my blood volume by limiting my ruids. 3. I need to maintain a low-calorie diet to prevent any weight gain. 4. I need to drink adequate fluids and increase my intake of high-fiber foods. Explanation question 9. Rationale. Constipation can cause the client to use the Valsalva maneuver. The Valsalva maneuver needs to be avoided in NCLEX with cardiac disease because it can cause blood to rush to the heart and overload the cardiac system. Constipation can be prevented by the addition of fluids and a high-fiber diet. A low-calorie diet is not recommended during pregnancy and could be harmful to the fetus. Sodium needs to be restricted as prescribed by the primary health care provider, because excess sodium would cause an overload to the circulating blood volume and contribute to cardiac complications. Diets low in fluid can cause a decrease in blood volume, which could deprive the fetus of nutrients. Test-taking strategy. Focus on the subject, the pregnant client with heart disease. Think about the physiology of the cardiac system, client and fetal needs, and the factors that increase the workload on the heart. This will direct you to the correct option. Question 10. The clinic nurse is performing a psychosocial assessment of a client who is pregnant. Which assessment findings indicate to the nurse that the client is at risk for contracting human immunodeficiency virus, HIV? Select all that apply. 1. The client has a history of intravenous drug use. 2. The client has a significant other who is heterosexual. 3. The client has a history of sexually transmitted infections. 4. The client has had one sexual partner for the past 10 years. 5. The client has a previous history of gestational diabetes mellitus. Explanation question 10. Rationale. HIV is transmitted by intimate sexual contact and the exchange of body fluids, exposure to infected blood, and passage from an infected birthing parent to the fetus. Clients who fall into the high-risk category for HIV infection include individuals who have used intravenous drugs, individuals who experience persistent and recurrent sexually transmitted infections, and individuals who have a history of multiple sexual partners. Gestational diabetes mellitus does not predispose the client to HIV. A client with a heterosexual partner, particularly a client who has had only one sexual partner in 10 years, does not have a high risk for contracting HIV. Test-taking strategy. Focus on the subject, risk factors for HIV. Recalling that exchange of blood and body fluids places the client at high risk for HIV infection will direct you to the correct options. Question 11. The nurse evaluates the ability of a hepatitis B positive birthing parent to provide safe bottle feeding to the newborn during postpartum hospitalization. Which action best exemplifies the birthing parent's knowledge of potential disease transmission to the newborn? 1. The birthing parent requests that the window be closed before feeding. 2. The birthing parent holds the newborn properly during feeding and burping. 3. The birthing parent tests the temperature of the formula before initiating feeding. 4. The birthing parent washes and dries the hands before and after self-care of the perineum and asks for a pair of gloves before feeding. Explanation question 11. Rationale. Hepatitis B virus is highly contagious and is transmitted by direct contact with blood and body fluids of infected persons. The rationale for identifying childbearing clients with this disease is to provide adequate protection of the fetus and the newborn, to minimize transmission to other individuals, and to reduce complications in the birthing parent. The correct option provides the best evaluation of client understanding of disease transmission. Option 1 will not affect disease transmission since hepatitis B does not spread through airborne transmission. Options 2 and 3 are appropriate feeding techniques for bottle feeding but do not minimize disease transmission for hepatitis B. Test-taking strategy. Note the strategic word, best. Focus on the subject, disease transmission to the newborn. Question 12. A client in the first trimester of pregnancy arrives at a healthcare clinic and reports has been experiencing vaginal bleeding. A threatened abortion is suspected, and the nurse instructs the client regarding management of care. Which statement made by the client indicates a need for further instruction? 1. I will watch to see if I pass any tissue. 2. I will maintain strict bed rest throughout the remainder of the pregnancy. 3. I will count the number of perineal pads used on a daily basis and note the amount and color of blood on the pad. 4. I will avoid sexual intercourse until the bleeding has stopped and for 2 weeks following the last episode of bleeding. Explanation question 12. Rationale. Strict bed rest throughout the remainder of the pregnancy is not required for a threatened abortion. The client needs to watch for the evidence of the passage of tissue. The client is instructed to count the number of perineal pads used daily and to note the quantity and color of blood on the pad. The client is advised to curtail sexual activities until bleeding has ceased and for 2 weeks after the last evidence of bleeding, or as recommended by the healthcare provider. Test-taking strategy. Note the strategic words, need for further instruction. These words indicate a negative event query and the need to select an incorrect client statement. Noting the word strict in the correct option will assist in directing you to this option. Question 13. The nurse is planning to admit a pregnant client who is obese. In planning care for this client, which potential client needs would the nurse anticipate? Select all that apply. 1. Bed rest as a necessary preventive measure may be prescribed. 2. Administration of subcutaneous heparin post-delivery as prescribed. 3. An overbed lift may be necessary if the client requires a cesarean section. 4. Less frequent cleansing of a cesarean incision, if present, may be prescribed. 5. Thromboembolism stockings or sequential compression devices may be prescribed. Explanation question 13. Rationale. The obese pregnant client is at risk for complications such as venous thromboembolism and increased need for cesarean section. Additionally, the obese client requires special considerations pertaining to nursing care. To prevent venous thromboembolism, particularly in a client who required cesarean section, frequent and early ambulation, not bed rest, prior to and after surgery, is recommended. Routine administration of prophylactic pharmacological venous thromboembolism medications such as heparin is also commonly prescribed. An overbed lift may be needed to transfer a client from an operating table to bed if cesarean section is necessary. Increased monitoring and cleansing of a cesarean incision, if present, is necessary due to the increased risk for infection secondary to increased abdominal fat. Thromboembolism stockings or sequential compression devices will likely be Question 14. The nurse is assessing a pregnant client in the second trimester of pregnancy who was admitted to the maternity unit with a suspected diagnosis of Abruptio placentae. Which assessment finding would the nurse expect to note if this condition is present? 1. Soft abdomen. 2. Uterine tenderness. 3. Absence of abdominal pain. 4. Painless, bright red vaginal bleeding. Explanation question 14. Rationale: Abruptio placentae is the premature separation of the placenta from the uterine wall after the 20th week of gestation and before the fetus is delivered. In Abruptio placentae, acute abdominal pain is present. Uterine tenderness accompanies placental abruption, especially with a central abruption and trapped blood behind the placenta. The abdomen feels hard and board-like on palpation as the blood penetrates the myometrium and causes uterine irritability. A soft abdomen and painless, bright red vaginal bleeding in the second or third trimester of pregnancy are signs of placenta previa. Test-taking strategy: focus on the subject, assessment findings in Abruptio placentae. Remember that the difference between placenta previa and Abruptio placentae involves the presence of uterine pain and tenderness with Abruptio placentae, as opposed to painless bleeding with placenta previa. Question 15. The maternity nurse is preparing for the admission of a client in the third trimester of pregnancy who is experiencing vaginal bleeding and has a suspected diagnosis of placenta previa. The nurse reviews the primary healthcare provider's prescriptions and would question which prescription. 1. Prepare the client for an ultrasound. 2. Obtain equipment for a manual pelvic examination. 3. Prepare to draw a hemoglobin and hematocrit blood sample. 4. Obtain equipment for external electronic fetal heart rate monitoring. Explanation question 15. Rationale: placenta previa is an improperly implanted placenta in the lower uterine segment near or over the internal cervicalose. Manual pelvic examinations are contraindicated when vaginal bleeding is apparent until a diagnosis is made and placenta previa is ruled out. Digital examination of the cervix can lead to hemorrhage. A diagnosis of placenta previa is made by ultrasound. The hemoglobin and hematocrit levels are monitored, and external electronic fetal heart rate monitoring is initiated. Electronic fetal monitoring, external, is crucial in evaluating the status of the fetus, which is at risk for severe hypoxia. Test-taking strategy: focus on the subject, nursing care of the client with placenta previa. Use knowledge of the pathophysiology associated with placenta previa. Note the words question which prescription in the event query. Also, note that the correct option is the only procedure that is invasive to the preg. Question 16. An ultrasound is performed on a client at term gestation who is experiencing moderate vaginal bleeding. The results of the ultrasound indicate that Abruptio placentae is present. On the basis of these findings, the nurse would prepare the client for which anticipated prescription. 1. Delivery of the fetus. 2. Strict monitoring of intake and output. 3. Complete bed rest for the remainder of the pregnancy. 4. The need for weekly monitoring of coagulation studies until the time of delivery. Explanation question 16. Rationale: Abruptio placentae is the premature separation of the placenta from the uterine wall after the 20th week of gestation and before the fetus is delivered. The goal of management in Abruptio placentae is to control the hemorrhage and deliver the fetus as soon as possible. Delivery is the treatment of choice if the fetus is at term gestation or if the bleeding is moderate to severe and the client or fetus is in jeopardy. Because delivery of the fetus is necessary, options 2, 3, and 4 are incorrect regarding management of a client with Abruptio placentae. Test-taking strategy: focus on the subject, management of Abruptio placentae. Use knowledge regarding the pathophysiology and management of Abruptio placentae to answer the question. Note the words term gestation and moderate vaginal bleeding. Knowing that the goal is to deliver the fetus will direct you easily to the correct option. Question 17. The nurse in the postpartum unit is caring for a client who has just delivered a newborn infant following a pregnancy with placenta previa. The nurse reviews the plan of care and prepares to monitor the client for which risk associated with placenta previa. 1. Infection. 2. Hemorrhage. 3. Chronic hypertension. 4. Disseminated intravascular coagulation. Explanation. Question 17. Rationale: in placenta previa, the placenta is implanted in the lower uterine segment. The lower uterine segment does not contain the same intertwining musculature as the fundus of the uterus, and this site is more prone to bleeding. Options 1, 3, and 4 are not risks that are related specifically to placenta previa. Test-taking strategy: focus on the subject, the risks associated with placenta previa. Thinking about the pathophysiology associated with this disorder and recalling that bleeding is a primary concern in this client will direct you easily to the correct option. Question 18. The nurse is performing an assessment on a client diagnosed with placenta previa. Which assessment findings would the nurse expect to note? Select all that apply. 1. Uterine rigidity. 2. Uterine tenderness. 3. Severe abdominal pain. 4. Bright red vaginal bleeding. 5. Soft, relaxed, non-tender uterus. 6. Fundal height may be greater than expected for gestational age. Explanation. Question 18. Rationale: placenta previa is an improperly implanted placenta in the lower uterine segment near or over the internal cervical os. Painless, bright red vaginal bleeding in the second or third trimester of pregnancy is a sign of placenta previa. The client has a soft, relaxed, non-tender uterus, and fundal height may be more than expected for gestational age. In Abruptio placentae, severe abdominal pain is present. Uterine tenderness accompanies placental abruption. In addition, in Abruptio placentae, the abdomen feels hard and board-like on palpation, as the blood penetrates the myometrium and causes uterine irritability. Test-taking strategy: first, eliminate options 1 and 2 because they are comparable or alike. Next, remember that the difference between placenta previa and Abruptio placentae involves the presence of uterine pain and tenderness with Abruptio placentae, as opposed to painless bright red bleeding with placenta previa.